I welcome you all on behalf of the Georgian people in Newvision University. I'm a neurosurgeon, I'm the youngest board certified female neurosurgeon in the country. I drill in patients' skull in order to get to the brain and to perform a surgery on a patient's brain. Today, I would like to get to the brains of young future doctors, but I will use only my words to do so. In order to introduce you to my country, I'll give a short introduction. Georgia is a beautiful country nestled in between Black Sea and the Caspian Sea. We have beautiful near neighborhood from the south and not so very friendly neighbors in the north. Whether Georgia belongs to the Europe or Asia due to the geopolitical position, it's right in the middle. But Georgian people, despite having many things in common with the Asian nation, they belong to the family of European Union. And these are the recent pictures of the Georgian people announcing loudly our belonging. Not many people know that the remnants of the skulls of the first Europeans were actually discovered in Georgia, in a city very close to our capital city, Tbilisi, where our university, Newvision University, resides, and where I teach and work as a neurosurgeon. And there are a lot of stories related to the name of the country. St. George is believed to have to be connected with the name. More romantic version of the name, however, is from the Persian. Gurkhan sounds like a wolf, so it's land of the wolves. But Georgian people will call it Sakartvelo. Kartvel is a Georgian person, so it's land of Kartvelians. Our country has 11 regions. Each region has its own beauty and texture and their own take on the culture and the food as well. We have beautiful sides, we have mountainous side, we have a little seaside, we have a lot of castles and greenery as you can see. And our alphabet is 1 out of 14 in the world. And this is the next one. You see the beautiful capital city, Tbilisi, views of the old Tbilisi, which we have preserved, and the seaside city Batumi, where students can enjoy their summer vacations. And other famous cities like Gori, the Catsky Pillar, which we can access only by climbing, and also the old capital city, Kutaisi, where I come from, small and humble, but beautiful and ancient. About the weather, the students can experience both summer and winter in one day because from the north we're protected from cold with the major Caucasian mountains, and from the heat of the south we're protected with the minor Caucasian mountains. The river Kura that flows in the city, and the third highest point in the Europe, Mountain Shara, that is also part of the Georgia. We have volcanic plateaus. We have a lot of caves. You can proceed. One of the deepest in the Europe, 2,000 depth underground is Krubera, Abkhazia. And we have a lot of stories and tales of the bravery of our ancestors. One of the oldest story is linked with the Jason and Argonauts. You might have heard. The Jason was a Greek prince who was sent to retrieve the golden fleece from Georgia. Yes, it's resided in Georgia. And the ancient King Gayeti was the king who gave impossible tasks like to defeat the dragon that never slept and to retrieve the golden fleece. And with the help of daughter of the King Medea, she was the first healer that was mentioned in the history. She had the whole garden of the herbal plants, which she used to put the dragon to sleep. And our beauties continue. You see that the Georgia is also motherland of the winery. We recently celebrated 8,000 years of the history of winemaking. And these are the ancient jars that are made of clay that are buried underground and filled with wine that enriches from the natural nutrients of the rich Georgian soil. And it has beautiful texture and beautiful color, which is unique to our country. And this is to celebrate the 8,000-year history of winemaking. And our national dishes, I know that nothing compares to Indian spices, but especially mothers will be worried about their children's whether they're gonna be well fed. But I assure you, we have a lot of national food that like khachapuri that your children will fall in love. If you taste once Georgian dishes, you can never forget the taste. And these are the different versions of khachapuri we're famous for, and also some couple of dishes. I hope you had your dinner. We have some beautiful dishes as well. You can proceed. And yeah, these are some traits that we're famous worldwide. And our hospitality, your children will be most welcome because they're gonna spend at least 6 years of their life in our country. So our country will become their second home. I had recently the case when we had 8 hour surgery, and we ended the surgery really late, and the students were observing. So I was worried it was getting dark and late, and I was worried that they had to walk home alone. And I said, "Are you not scared?" And they answered, "Ma'am, but this is Tbilisi." So, and I felt joy, and I was really glad because not just I feel safe because it's my home, but also they feel safe because it has become their second home. And our famous Georgians, I will just pass on it, and the views of Georgia. And we're famous in sports as well. Our New Vision appreciates not just the mental development, also physical development. Our students have they can have leisure physical activities in our around our campus as well. So these are the famous UFC champions from Georgia. And after a short introduction, now I would want to talk about our university. We celebrated 10 years university, and in a span of 10 years, New Vision University has achieved unimaginable heights. It was impossible this such a short amount of time to achieve what we have achieved. And these are, yeah, you can move it forward. We value the sustainable development, and our goals are to keep developing year by year to reach new and new heights. And I will not stop, but you can see yourself the rankings, which speak for themselves. And these are all achievements we're proud of, and this is because of the idea behind the university is to give a bright future to the bright students with the brilliant minds and to explore their potential and for them to guide them to help them to reach their maximum potential. And this is our beautiful campus. And the next one is actually, yeah, we have beside the medical school, we have a law school, and now we'll have cinema school that is a brand new building is opening up. In the upcoming slides, you'll see. And these are all the partnerships. We have our young university hospital, without which medical university cannot be on the level without providing the clinical experience and acquiring the clinical skills that future doctors need. And this is the essential tool in their armory. And we have our own insurance, and this is the cinema school that will be opening in upcoming months. And you see the new building and European professionals with European how's it base core fundamental how to say they will guide us, and the students will be guided according to their the European standards. as to conclude, I will show you just my personal. We can to make it short. The long story short, I will just share personally because I'm a neurosurgeon. I'm a practicing surgeon, and how I practice. Beside the neurosurgeon, I'm an educator. My second PhD is dedicated to the educational sciences, and this is how we train our students. Before they get their hands on the actual real patients, we have the simulating training where we use the cadavers in order to teach them the manipulations that they will in future will do on the real patient. So in here you see how I teach my student to perform a ventriculostomy. It's to put in a burr hole in a skull and put in a tiny catheter through the brain inside the ventricles in order to drain the excess CSF. It's the most common procedure the residents of neurosurgery perform. And here I am teaching them how to do it on the cadaver, explaining all the anatomy as well as letting them do. Like this is the way we approach. They learn by doing things because the clinical skills are acquired this way. They learn and we teach by let them doing the procedures. And you can see like they can yeah, and this is the unique case I also shared with the students. Very, very difficult case, 40 years old female with the multiple tumors of the skull. The bone was broken down by the skull, and our students had witnessed many of the doctors abroad said no to the patient, but we admitted the patient and we performed the surgery excising the entire tumor and also reconstructing the cranial vault by using the bone cementum. And I remember this case, it was really rewarding because the patient at the day of discharge thanked us and said that we brought the life back because for last years she couldn't look at her image in the mirror without fear and being scared, and now she had tears of joy. And my student said, I will never forget this case for the rest of my life. And this is what makes a practice, the real life experience that lasts forever. And here, I this is the way I teach is from A to Z, from the positioning of the patient, performing the first incision, what are the anatomic structures that they are cutting, what are the instruments they're using, and in here, these are the videos. They're taken by the student. Yeah, yeah. This is the real life patient putting boreholes, and the students are absorbing the surgery as we speak. And as I'm doing the surgery, I explain what are the tools that I use for every step. And you can see I take them step by step how to expose every tissue. I know it's for some students might be a bit too much, but they need to be exposed early on in order to know what they're gonna deal with and what is the challenge ahead of them. So, and also, I noticed that some of the students, like once the major surgery was done, they were leaving the OR. So they were not looking and witnessing the closure part because the opening of the skull is, and the closing of the skull is just as important as the exposure of the brain. So then I showed them this example, the next one. The baby, 2 years old, operated in another center. They saved the baby's life. They managed to save him, but they failed to close the wound correctly. So the extra CSF due to the leakage accumulated under the skin, and the baby had another head on his head. Just show the picture, and I showed this picture, and then we performed another surgery. We put a bone cementum, and we fixed it with the titanium screws and plates. And after showing this case, it meant more than 1,000 words I could say to them, because just by seeing the real life case, they understood the importance of every single detail during the surgery. So once I showed them this case, they never left the surgery until the very last person leaves the operating theater. And here are my students. she graduated last year, and this year she called me with a happy voice. She passed the Indian board exam, and she is an inspiring example for the juniors. And these are all my students that I've taken in the OR. And last week I took a lot of photos. We were doing rounds in one of the largest, not one of the, but the largest hospital, children's hospital in the entire country. And they're witnessing newborn babies, how the surgeries are performed on newborn babies, because neurosurgery is from 0 hour to the elderly people. So we treat both children, newborns, and elderly people as well. So, and here I'm handling, and she is a fifth-year student. She was multiple times in my OR, but this is the first time she actually got to scrub in. And you can see I'm handling over the instrument, and she has this scared face because she wasn't expecting that I would let her take parts, like do the surgery. And she is now suturing beautifully, as you can see, and bravely. And this is hello from the students, from the audience. And also, I would like to end my presentation with the last slide, because we're open up for the any discussions, any debates, any way of communication. Every week we have open sessions and open discussions on the most important and relevant topics in a modern medicine. Last 2 weeks ago, actually, we had a talk about Alzheimer's disease and dementia. We discussed the diagnosis, what are the challenges, what are the complications that healthcare professionals encounter, and we talked about the future prospects and research in this field. So, and this is the way we teach. We teach in the auditorium, we teach in a hospital setting, we provide real life experience that is really, really precious and priceless. And I encourage you, future doctors who have set their goal to wear the white coat, to become the protectors of life. I really encourage you to take the first step forward, and I would be really happy to welcome you to Georgia, to the Newvision University, that will open the door for you for the brighter future. Thank you very much.